So I'm just doing a follow-up recovery video for my sinus surgery. I had a slightly deviated septum. My sinus cavities right here weren't draining properly. Apparently, like, the pathways are too narrow, so they cut out my phalanges, they said, like some to make room so then they'll drain properly. And I had an extra sinus cavity over here that they said they could just cut out. So I was like, why not? Hey, Steve. That's my cousin. He lives in Texas, so he's a lot warmer than I am right now. I watched a lot of YouTube videos about sinus recovery so I could kind of prepare myself. All in all, it was way less painful than I thought it would be. She tried to put an IV in my hand right here. Like, you can see one freckle and one part where she tried to stick the IV in. And it just wouldn't take. I have really thin veins, so she had to put it in my arm right here. And really, that was the most painful part. And they wheeled me back there, and I was out before I knew it, and awake and feeling fine. What's awesome is they pack, like, up here with some foam, and that dissolves. What's really weird, though, is that I can feel the plastic, like, right here in my nose from what they put in, and then they'll pull out on Friday. You can Google that as well to kind of see it. That sounds painful, them pulling the plastic out. It used to be gauze, but nobody looks in pain in the videos, and it just looks kind of uncomfortable, but definitely not painful. So in preparation, I got Tylenol Extra Strength, because you're not supposed to have anything like aspirin or Aleve, you know, because of the bleeding, and I usually take Aleve. They prescribed me some nasal sprays. One is just a basic nasal spray, nasal rinse, and that one I'm supposed to use multiple times per day to flush everything out. And some people had said that their nasal sprays sting, but these ones definitely did not, so that was a plus for me also. I have this other one, this anaphrine nasal spray that I'm supposed to use if there's a lot of bleeding, and there's more bleeding out of this nose than this one, I think, because of that extra sinus cavity. And then they send you home with gauze and tape, and so that I've been wearing most of the day because I took a little nap. You just roll under your nose and put it here like a sweet little Hitler stash, and then you just put the tape along your face so that, you know, the blood will drip onto the gauze. I also went to Walmart, got a couple shirts like this that were like $3, just in case, you know, I was sitting up talking and blood just drips out. Didn't want to ruin any of my shirts. So there's that. I don't know. Oh, well, I guess we'll finish with the meds. I have an antibiotic that I'm supposed to take 4 times a day, and then they prescribe me pain pills that I can take 1 or 2 every 4 hours or as needed. I watched a video where this woman was trying not to take them, and then she talked about how much pain she was in and how it takes a while to kick in. So I just decided that I was going to take them every hour on the hour, so I set alarms. I just took some at 4, and I'm going to take some again at 8, because I don't want to wait to see how painful it can be and then have to wait for the pain meds to kick in. So I'm just doing 2 definitely today, every 4 hours, and we'll see how I feel. All the YouTube videos just made it seem like it'd be a lot more painful, and so far I've felt completely fine, so I guess I'm on the easier side of things, and I had 3 procedures done in there. My roommate was really nice, and he dropped me off, picked me up. We went and got my medicine at Walgreens, and oh, see, blood. But this is because I just did the nasal spray, so I knew that by using it, it would, clean everything out and make, the blood and crusty grossness come out. I also thought it'd be a good idea to get wipes, just in case, like, I woke up from a nap with dried blood. Then it'd be easier and less painful to, like, wipe around the area. I'm not wiping dried blood. I don't have to get up and get water or anything. So I have some little children's wipes over there. Gatorade, water. My throat hurts a little, because they have a tube down in your throat and your mouth is just open, so then it's dry. The procedure they told me would take 30 to 45 minutes. While I was in pre-op, they said it could take up to an hour. So, I don't know how long it actually took. I know they were ahead of schedule when I went in, but they didn't tell me how long I was in there. And so nonetheless, it didn't take all too long. My throat's just a little sore. But again, I watched YouTube videos and saw that one girl said that her lips were really dry, so I have extra chapstick by my bed. I have tea and honey right here upstairs. And again, like, I can walk around and I'm fine. I just threw in, more blood. I just threw in a load of laundry. They said I can't drive today, but I feel really, really fine. Just a little sore throat is the worst part. I'm lucky that the tube didn't scratch anything like it did this one woman in one of her videos. So, I hope for a speedy recovery. I get the plastic pulled out on Friday, and then I'll go back in 2 weeks for a follow-up. The videos I've seen with them pulling the plastic out, people say they've never been able to breathe so well. So, I feel like I took all the precautions that I could and should. Extra tissues, wipes. I had purchased a saline rinse in case they didn't prescribe me one. Had my roommate down to be able to pick me up, get any information. Gave him all my information for the pharmacy so that he could pick up my meds if I wasn't coherent, which I totally was. And I guess I'm just really lucky because just like after my wisdom teeth, I was walking around. I don't know if I was supposed to be eating, but I couldn't eat since last night. So I was like, let's go to Arby's. And I think that made my nose bleed a little bit more when I got home because, I'm just like, and I just got really tired around 2 or 3, so I took a little nap. I was having trouble, though, staying asleep, not because of any discomfort, but just, it's just drowsiness from the pain meds. I'm not really tired, I'm just drowsy. So I've just been kind of in and out of it on my phone, talking to people, Facebooking, might watch a movie, but all in all, it's been really easy, and I'll keep you up to date with anything else as it comes. But if you don't see any more posts from me about the post-sinus surgery recovery, it's because I'm just using the rinses, which will, make things bleed a little because it's clearing out. They said that if there's, a lot of blood, to obviously call them. But it's all been really manageable, good, easy, and those videos all seemed worse. So I don't know if mine's newer and they have newer technology and stuff to where it's not as painful or what, but it's been great and easy. So if any of my friends want to come visit me, just send me a text, because I feel like I'm up for at least having people over and sitting watching movies with me. Thanks for stopping in.